Another bacteria called Staphylococcus, epidermidis, and saprophyticus. These are two bacteria and they are from same family, Staphylococcus. So who are they? They are epidermidis and saprophyticus. They are from same family, from the same Staphylococcus. They are both gram positive. It means they are violet on the they are gram positive, they are violet color, and they are cocci, it means they are grape shape. They are catalase positive, it means they make catalase. They have O2 bubble, they break down the hydrogen peroxide and they render the bleach inactive. So they are coagulase negative, both of them are coagulase negative. It means they do not clot, it means they cannot hide. Okay, they cannot get hide. They cannot get high. I mean, they cannot hide under the clot. So they are coagulase negative. They cannot hide, unlike their sibling, that's Staphylococcus aureus. Staphylococcus aureus can clot the blood. So they are Staphylococcus is coagulase positive, but both of them, epidermis and saprophytic, are negative. One another thing is called urease positive test. They are both of them are urease positive. It means they can split the urea into ammonia. So they are coagulase negative stuff. So they are called as cons. They can't hide under the clot. Okay, let's talk about staph epidermidis. Well, epidermidis, again, it shows something with the skin. What does it mean? It means that it lives on skin, it gets into medical device, and it causes infection. It's one of the worst enemy of orthopedics. Orthopedics. They are part of the normal skin flora. The number one enemy for epidermidis is hardware, orthopedic joints, and prosthetics. They can get inside your blood via any catheter tubes, IV lines. They can go and attack your heart valves, which causes endocarditis, especially prosthetic valves and artificial valves. One of the key features that they have is that they have something called as biofilm. Now, this biofilm is really dirty. It's a really sticky polysaccharide slime, and it gets attracted to the metal and plastic part which is inside your body. So that's why all of this staph epidermidis, it attacks on orthopedic joints and prosthetic joints, and even on your prosthetic valves, and even on artificial valves. So that's why, because they have biofilm, and this is the reason they also get protected from your immune system, right? They also are one of the biggest contaminators of blood culture, because they are almost everywhere. So they can grow anywhere. So they can grow on a lab, and they can show a false positive on a patient report. So the lab guy has to be really sensitive, really careful about this contamination. They are novobiocin sensitive. Epidermidis is sensitive to novobiocin, and the treatment is they are resistant to many antibiotics. So we can give them vancomycin, same as MRSA. One other thing is novobiocin. We can give them novobiocin. If they are resistant to novobiocin, we can give them MRSA. And I remember this staph epidermidis as they have biofilm, which is bio in it, and novobiocin also has bio in it. So staph epidermidis is sensitive to novobiocin. Cool. Another thing, okay, just look at this guy. This guy is like a staph epidermidis because it's dirty, it's sticky, it has a lot of biofilm everywhere. So it's number one enemy of orthopedic doctors. Okay, another thing is staph saprophytic. So staph saprophytic, let's look at the name saprophytic. Saprophytic means pertaining to organism that live on decaying matter, right? So just whenever I say saprophytic, look at this young woman at traffic light. So not traffic light, it's, you understand me, right? Red light area. So it's a young woman. So think about young woman, think about UTI. So not skin, but UTI, because staph saprophytic is normal flora of female genital tract, and they causes UTI. They are number one, not the number one, they are number two, second most cause of UTI after E. coli. And the staph saprophyticus is resistant to novobiocin. So novobiocin only works for the bacteria who produces biocin. That is, they also produce biocin. They also produce this biofilm, but remember, epidermidis is not resistant to novobiocin. It's sensitive to novobiocin, but saprophyticus is resistant to novobiocin. So we resist. So we go for another drug, that is TMP-SMX, for antibody, for not antibody, simple UTI antibiotics, not antibodies, antibiotics. So simple UTI antibiotics, we can give them TMP-SMX. And remember this image: UTI resistant to novobiocin, and they are Staph saprophyticus. So that's the whole